Guys, this video is going to be about acute gout and how to treat it. So we can divide the treatment into C and S. So colchicine, NSAIDs, and steroids. So C and S. Over here, the first line treatment is NSAID, second line being steroids, and third line being colchicine. So over here, NSAIDs. Over here, I'm going to come back to this slide. Yeah. So NSAID. So we're going to speak a little bit about the examples of these. So there's going to be three main examples. So we have naproxen, indomethacin, and ibuprofen. So we want to give this we want to give this it's like acute gout, so it's going to be treatment before the 24 hours, but we want to give this for a duration of 3 to 5 days. We want to give this, and the contraindication is obviously gastric ulcers, ulcers. So this can cause gastric ulcers. So we don't want to give in those patients. And which drugs we give in patients with gastric ulcers? Well, that's going to bring us into the next one, which is going to be over here, the glucocorticoids. So glucocorticoids can be divided into two main types. We have the systemic and we have the intra-articular. So IA over here is intra-articular. So the oral ones can be also divided into two. So prednisone, and there's another one which I'm forgetting, which is going to be prednisolone. So prednisolone. We also have parenteral and intramuscular. So these are going to be these can be your methylprednisone. So methylprednisone. So this can also be here your parenteral or your intramuscular types. Addition to that, we also going to have the intra-articular. Intra-articular is going to be if it involves maybe one or two joints, and these are going to be for refractory cases. If they are going to be kind of refractory, so we can consider this as well. And the time when we give the parenteral or intramuscular is when we're going to have NPO. So when we cannot give nothing per oral, maybe some dysphagia or something like that, then we have to give this methylprednisolone. The contraindication is not kidney disease. In fact, it is chronic kidney disease. And the glucocorticoids are preferred if there are contraindications. For example, chronic kidney disease, so these are kind of not preferred. It's actually indication is when we have chronic kidney disease or no response to NSAIDs or the colchicine. Over here we have the colchicine. Colchicine, again, what is the mechanism? This is going to inhibit tubulin polymerization. So polymerization. So the microtubule polymerization. Adverse effects is loads. It has a loads effects, so it's not. That's why it's third line. So cardiac toxicity, CNS, cardiac CNS. Cardiac CNS, we also have bone marrow problems it can cause, and it is ineffective in certain scenarios. It may become ineffective in some scenarios. I may have to check this out. Yes, so it should be. It is ineffective if maybe initiated 24 to 36 hours. After onset. As we spoke about, this is going to be acute gout, so we want to do this quite early on. And the contraindications, I want to speak about NSAIDs and systemic glucocorticoids should not be given together. However, if there is maybe some sort of if we give them together, we have to also prescribe PBIs. So these are going to be for the ulcers. So here's, guys, a quick overview on mnemonic. So the C and S, central nervous system, or the NSAIDs being the first choice, second choice being steroids, third choice being the colchicine. NSAIDs can be naproxen, indomethacin, ibuprofen. We usually give this is acute treatment, so the first 24 hours, but we do give this for a 3 to 4 day period. And chronic indications are obviously gastric ulcers. We're here glucocorticoids. Glucocorticoids can be divided into two main types: systemic or the intra-articular. Systemic is also divided into two types. So oral, so that can be your prednisone or prednisolone, or it can be IV, which can be methylprednisone. And methylprednisone is when nothing per oral, so maybe some sort of dysphagia or some sort of problems with that we cannot give anything per orally. The next thing is going to be intra-articular. Intra-articular is 1 to 2 joints. indications for glucocorticoids is going to be that there's going to be some sort of chronic kidney disease, or there is going to be some sort of chronic kidney disease, or for instance there is no response to NSAIDs or the colchicine. The next thing is going to be the next thing we are going to have to mention over here is going to be the colchicine. Colchicine, what's the mechanism of action is going to be that it inhibits tubulin polymerization, microtubule polymerization. Adverse effects is that it can cause cardiotoxicity, CNS toxicity, bone marrow depression, and this is going to be quite ineffective. It's been quite ineffective if, for instance, it's going to be initiated after 24 to 36 hours. So that's a quick overview. C and S, that's your treatment for acute gout. And thank you guys for watching. I hope to see you guys next time.